Hi everyone! Welcome to our Ask Me Anything. Today we have our speech therapy edition where you can ask me anything you want about speech therapy, of course. So this is part of our Aphasia Awareness Month outreach program. We have been keeping up at it. It's been such a crazy month, coming to our last few days. This is our final edition of the Ask Me Anything. And we have one more Facebook live on Thursday, Connecting the Dots, where we will be interviewing a doctor. So Dr. Chan Yao is a friend and also an excellent physician. He will be sharing his perspectives on aphasia. So we really hope you can join us. Well, if you actually haven't had the chance to check out some of our previous events, for example, we have done a human library just, 2 Sundays ago, where we featured Miss Lim Hai Yen, right? You can actually check out all this interesting stuff on YouTube. Please subscribe to our YouTube channel. I cannot emphasize enough how amazing our YouTube channel is. Our YouTube channel has a lot of original content and we are beefing it up. So if you are a speech therapy student, if you are somebody who's interested to learn more about aphasia, if you're a caregiver, this is an excellent resource channel. Okay, just please check out our YouTube channel and subscribe to our Aphasia SG YouTube channel. Okay, now without further ado, I'm gonna go right in and start talking about speech therapy. So I think my team has prepared like a long list of questions. Thank you, team. And some of you actually responded to our IG stories about questions that you have for speech therapists and about speech therapy in general. I am just going to kickstart right in and talk about what do speech therapists do. Okay, what do speech therapists do? Good question. Okay, let me share this. Well, you guys can see, right? So interestingly, and it ties in with another question now, okay, but sometimes people look at this name, this title, right, speech therapy, and they think we teach people how to talk. That's just like a tiny part of it, okay? As speech therapists, we actually work with, the entire spectrum of population from infants all the way to an adult, geriatric adult, end of life. And we can work with them in terms of communication, right, which is really a big part of what we do actually at Aphasia SG. And we also see them for swallowing problems. So I think if any of you have actually had the chance to come into contact with speech therapists in the hospital, you know that dysphagia management is a big part of what we do. And also we can help patients who stutter, right, who stutter, and we also work with patients who have voice problems. And some of you may be very familiar with, speech therapists who work with children. Interestingly, when I was not yet a speech therapist, I did a mid-career switch. I actually thought that speech therapists only work with children. Silly, right? So I thought, speech therapists, you only work with children, because that was kind of like my limited worldview. So obviously I did my research and I also had the chance to go into the hospital to observe. Then I realized, wow, it's actually a whole big wide world out there, and there's many things that we do. As I mentioned, we can work with communication disordered patients, adults and children. We can work with voice patients, right? So that's the indicators. And we can work with persons who stammer, and also people who need alternative form of communication, so AAC, as well as swallowing management, swallowing impairment. Okay, thank you all who join in. Please feel free to ask questions. You type in your questions and then I will flash it. Okay. Oh, okay, there's one question here. Let me check it out. Okay. What's a typical day in the life of an ST like? ST stands for speech therapist. The daily response. Yeah, I cannot see lah. I can't read now. Okay, the daily responsibilities of your work, etc. Okay, so it's a really good question, and I think it also depends on what clinical setting you're working in. So I used to work in an acute hospital. A day in my life would be, for example, seeing patients that are referred to me inpatient in the wards, and then I also see patients in the outpatient clinic. And then as for which indicator, it depends on your training also. So I was working in a general hospital, and I had the good fortune and to be trained in different areas like voice, and then also working with obviously swallowing, and that's a bread and butter of what we do in the hospitals, and language. So aphasia was a very big part of the patients patient caseload that I work with. But if you're working in a different setting, say you're working in a special needs school, then it'll be quite different, right? You'll be working with a different caseload altogether. You might be working with children on who has ASD, right? And then the referral process is different. So it will be more like the teachers in the class, the special ed teachers will be referring their cases to you. So also you can be in a private setting. So I would say a typical day differs. A typical day differs depending on which clinical setting you're in. Yeah, and because the caseload also differs. Good question. Yeah. Okay. Thank you all who are asking questions. Let me see. Let me try to take them. Okay, maybe I'll answer this one first by Hey WQ. How does one become an ST in Singapore? Okay, good question. So for me, I did my master's in NUS. So there are two schools in Singapore that offers speech therapy program. One is NUS, where you can actually get a master's. So you need to first have a bachelor degree. I think it's quite competitive to get in, and the course actually runs once every 2 years. But now SIT also offers the speech pathology program, which is great. So you can graduate from your A-levels, and then you can go into SIT, and then after 4 years you can come out and practice. So that's the Singapore route. But of course you can go overseas, right? You can actually go to Australia. Many of my peers are trained in Australia. There are many universities that train speech language pathologists in Australia, and you can go to the UK as well. So there's different options. But if you wish to be trained in Singapore, well, SIT and NUS are the schools that you can go to. Thanks for the question. Okay, let's see. Okay, there's a question from Simran about how do you diagnose an adult with speech problem. Okay, so I think this is also quite related to some of the questions that came in through IG stories. Let me see. Okay, there's one question here about, there's also a question here about treatment of patients with language or communication problem. So let me just take that question first by Ed. When we assess somebody with a speech problem, so when you say speech, right, okay, let's say communication, it's actually very broad. Aphasia is just one of the acquired communication problems that a person can have after a brain injury, after a stroke, even with a progressive neurological condition. But there's actually different types of acquired communication problems that one can have. So first, we need to find out what exactly is the problem. And we look at things like the medical diagnosis, right? And we also look at the brain scans, right? And we also will use our assessment tools to assess, right? To find out whether it is a motor speech problem like dysarthria, or is it more of a language problem like aphasia, or is it more of a cognitive communication problem where the person has behavioral changes, and also has difficulty multitasking, turn-taking. So, when we use a term like speech problem, sometimes we say things like this, slurred speech. It's very layman, just so that the caregivers understand us. But it's actually a lot more nuanced than that. And we need to find out exactly what is the problem in order to treat it. The most challenging part is all these problems can coexist, meaning they can be comorbid, right? And when it is, like, for example, our patients who have aphasia often also have apraxia of speech. So aphasia is a language problem, but apraxia of speech is when they have difficulty coordinating, their motor, the motor articulators to go the way they want to. So I like to give this example of, for example, in their mind, they're thinking chicken rice, but then what comes out of their mouth is kitchen lice, right? It's entirely different from what they're thinking. And it's comorbid. So as a treatment goal, we then have to decide what can we treat first? What do we treat first? Yeah. So and that's why we do recommend that if your loved one has a communication problem, to actually seek the help of a professional to find out a little bit more. And as a family member, don't be scared to ask questions. Ask the therapist, why is it done this way? What exactly are you doing? It's perfectly fine, because we do work closely with family members so that you can take whatever we are doing in session to actually practice with your loved one at home, right? Because at the end of the day, therapy is actually ongoing. It's not just about once a week or twice a week. Actually, you want this person to practice every day. Yeah, good question. Thank you so much. Let's see. Yeah, welcome all who just joined us. Today we are talking about speech therapy. So feel free to just ask any questions you might have, okay, about speech therapy. So I've answered questions about a typical day for an SLT who needs speech therapy. Okay, so there was a question from the IG story. This person actually asked, okay, how much do speech therapists earn? Okay, and which is yeah, okay, so how much do speech therapists earn? I don't know how things have changed. The scene might have changed a lot since I became, since I started. But when I first started being a speech therapist slightly more than a decade ago in an acute hospital, I think the starting pay was just like maybe over like in the range of 3 to 4 starting pay, but that's in a public hospital, in a restructured government hospital. I don't really know how much like people in the community earn as a starting pay, but go figure lah. After that you progress and all that. Yeah. Okay, White TX Lips ask, was it hard to get into the NUS speech therapy program? Curious what prerequisites are needed. I think it is challenging. I mean, even when I was in school, our lecturers, our program coordinators will always tell us that, oh, you guys are very lucky to be in the course. I think it is fairly competitive because it only runs once every 2 years. In terms of prerequisite, right, they will tell you it's ideal if you have a related bachelor degree. So say in linguistics, psychology, or biology. So things like this. Speech therapy to me is, it's not just science. It's actually really a mixture of science and art and language. So you do need the sciencey part of things where you learn neuroanatomy, you learn about anatomy, but there's also a lot of soft skills needed, right? We do need to have skills like empathy. I know it sounds very common sense, but it's not. I don't think everybody can be a therapist, to be honest. And yeah, I think that's what the panel is looking out for when they interview us, when they actually send us for what do you call that, like attachments also, to just see how we perform under pressure. I think they do make us go through this written test at the start to see like how we respond to certain questions, some scenarios. Wait, I think there's also a question earlier on from my team. They also asked this thing about the are there differences between the speech therapy program in different schools? I would say, okay, I don't know how things are like between SIT and NUS, but I will say from personal experience, I think content covered will be fairly similar, but when you are doing your studies overseas, right, what you don't get would be the opportunity to perhaps do clinical placements here, unless you request to do clinical placements in Singapore. And our population, is really quite different. If you do your placement in a acute hospital in Singapore, in the wards, right, the patient caseload that you see, the ama akong, will be quite different from obviously an Aussie population. That's one. And also I think the network that I forged with my classmates is really quite valuable. And even now, our classmate is like having this ST, very tight ST support group that you have for life. And that's something I think which is quite irreplaceable and priceless. I don't think there's probably not too big a difference between SIT and NUS program. But with the overseas and local program, because when I was in school, there wasn't yet like an SIT program. So I always think that's the biggest difference, because with our peers, with my peers who graduated from overseas, sometimes they do report feeling a little bit isolated because all their classmates are overseas. Then when they are with us at work, maybe we are a little bit more senior, so that kind of thing. Yeah. Okay, let's see. What are some challenges of being an ST by Kim GY GJY? Okay, there are many challenges. Where do I start? You know, a lot of things we learn in school, school is school, right? When you go out to real life and you see patients, you know, when you are working with a human being, I think that's when the real learning starts. And a lot of the challenges, I think at first, I remember the first 4 years was really just it was just really a lot of learning. You know, every day I was so exhausted from just learning, and everything. I just wanted to absorb all this information. And I think one of the biggest challenges is because we are dealing with humans, and sometimes we want, for me, you know, I want to find solutions quickly, and I'm sure, you know, they do. And I think with therapy, you know, and especially when we work, you know, in areas of like language acquired communication disorders, there's no magic pill, there's no fast answers. And when family members, you know, ask questions like, what's the prognosis, you know, can you tell me when, you know, my husband, you know, will recover or get well? And these are questions we have no easy answer to. So, you know, we of course, then, you know, the thing that we say is it really depends, which is correct, which, you know, it really depends. But I think it's very challenging, you know, having to sometimes, I don't know, like not be able to come up with like a optimistic answer, right? I think, yeah, everybody wants to you know, be the bearer of good news, yeah, but it's not so easy. Our work has a lot of challenges in terms of perhaps the patient you're working with is not very motivated, maybe not through their fault, maybe it's just part of the brain injury, but then it will impede the progress. Yeah. So we have to keep trying ways and means. And I think we do speech therapy, but then part of the challenge also is about learning things transdisciplinary, right? We also have to learn a little bit of what OTs do, a little bit of what PTs do, a little bit of what MTs do. That's what a good therapist should do, because we do a lot of co-treatment. Yeah, so all that would be part of the challenges. Yeah. And then there's a question here about what's the most rewarding part of your job. Just as that, you know, working with human beings is like the most challenging part, I think that's also the most rewarding part of our work. You know, if I didn't become a speech therapist, I might have become a teacher, I think. Simply because, you know, I really got sucked into the whole like starfish story lah. You know, but I think it's true, because what we do, right, our work is life-changing. We can help a person and their family, you know, improve on communication, or even, you know, even if you talk about swallowing, what we do is so impactful and so meaningful. I think that is probably the most rewarding part of our work, being able to administer change, a positive change. And even if it's not always positive, right, but I think just being there to, you know, letting the family know that we understand, and that we are there to support, I think that's very rewarding lah. Yeah, so I mean, that's good. I really like that. Okay. Okay, here's a question. Can STs also be a music therapist? Can you have 2 specializations? I think the short answer is yes. But it'll probably take a very long time for this person to first study speech therapy or music therapy, and then, you know, switch track and then go and do speech therapy. Because if you think about it, if it takes you, let's say 4 years, like you do a bachelor, and then you go and do music another 4 years, wow, you're like studying a lot. Technically it's possible though, but if you guys tuned in to our interview with Jonathan, our MT last week, you know that to be a music therapist, you must first be very adept, and you must be adept in your musical skills. So you must be able to play an instrument very well, right? So not everybody can do it this way, but yes, technically it is possible that an ST can be a music therapist as well. Hello from London. Hi. Thanks for tuning in. Okay, let's see. Holy moly guacamole. Oh, I love your handle. How should one decide if they are more suited to work with children or adults? Hey, great question. Like, you know, I joined this profession thinking that it was really just about kids, right? Because the earlier part, I'm a mid-career switcher, so the earlier part I was just working mostly with kids. I never thought that I will enjoy working with adults so much. So I will say, you know, in the first part of your career, just explore and, you know, try different things, and then you will find something that calls up to you the most. You know, there isn't a right or wrong answer to it, right? Some people love working with a certain population, and they're really, really good at it. So I think whatever, at the end of the day, whatever floats your boat, and really whatever you feel most connected to. Yeah, but in order to do that, you must first explore. So I think the first, you know, 4 to 5 years of your career, just try anything, and read. I guess just read papers and see what calls up to you. Yeah, I've always been very interested in language lah. So I must say that's quite my thing. And I remember last week we talked about Oliver Sacks a little bit, the neurologist. I remember reading his books even before I was a speech therapist and going like, wow, that's like super cool. Yeah. Keep the questions coming, guys. Okay, we only have another 8 to 10 minutes more. Okay, let's see. Okay, my team prepared a lot of questions from the IG stories. Okay, if I miss out your questions, sorry, okay? It's not intentional, but I'm having a bit of a hard time going through all the list. Okay. Okay, there's one question here from IG stories. What advantage does a speech therapist and a patient have if the speech therapist knows multiple languages that the patient knows? Conversely, would one ST be picked over another because of language ability, even if the other is deemed to have better clinical skills or expertise related to the patient's needs? It's actually a really good question. I will say, if you are going to be doing language therapy with a person, right, it will give you a huge advantage to speak the same language, right? There have been circumstances where I have had to work with patients who speak a different language. So the translator will usually be a family member. So it could be, for example, like a very elderly amma who doesn't, and I don't speak the same dialect. I speak Cantonese and Hokkien, but and a bit of Teochew, but I don't speak Hainanese, right? Then the doctor will have to translate. When it's done this way, sometimes it's lost in translation because the cues that you give will be different. And as a family member, when they're translating, they are not just translating verbatim, right? They can be doing different things also. So I will say, if you're gonna be doing language aphasia therapy, speaking the same language will give you this huge advantage. Yeah, I will take a junior therapist who speaks the same language than a senior therapist who doesn't speak the same language. Yeah, to answer that question. Yeah. Okay, let's see. I'm impressed and inspired by your vocation. It is not easy. What gives you the desire and motivation to continue? From Ben Chong. Thanks for the question, Ben. And I think, okay, so this is related to the question I answered earlier about rewarding. What's rewarding about the job? I think the fact that when I do my work, I'm able to actually help someone. It sounds very, it's not just this whole, like, you know, help. It's not just about being a saint, right? It's not. The work that we do, there's also, it's very administrative also, you know, and there's many parts to it lah. But when we do therapy and when we are able to be in that position to really help the family and the patient, it is very rewarding, and that motivates me to continue. You know, and you know, obviously there are days when I feel super tired, like super tired, but you know, but yeah, no matter how tired I am, you think about it, you are going to be working with somebody who is actually unwell and, you know, has gone through a major, you know, critical illness. Your presence there is going to help that person so much. It is really that kind of thought that keeps I think a lot of us going in our profession. Yeah. Okay. Jelly says interesting. All right. Okay. Now we are coming to the tail end, so please ask whatever questions you might have. Let's see. Okay, I'm gonna pick up one of the IG story questions. Okay, this question is interesting. How common is it that people misunderstand what speech therapists do? For example, do you hear people saying, my father has difficulty swallowing, but I don't need a speech therapist because he doesn't have a speech problem? Let me just say, if I get $1 every time I hear somebody making this comment, my father or my somebody has a swallowing problem, but he doesn't have a speech problem, he doesn't need a speech therapist, I'll be quite rich by now. Yeah, so it's the name, right? It's like, oh, okay, because we are speech therapists, so we only help people to talk. Not true lah, not true. Okay, I'm just gonna flash this slide again. Okay, we do many things. Yeah, we do many things. Okay, not just teaching people how to talk. So yeah, I'll be rich, man, if I get $1 for every time I hear that statement. Especially when it comes to working with patients who have swallowing problems. I think in the US, people who specialize in this area, like dysphagia management, actually call themselves swallowologists. Yeah, they do. Yeah, so it's quite interesting. I'm just gonna do a bit of a shout out. Okay. Wait, to this there's a question about Aphasia SG, I think. Yeah, I think somebody actually asked about why did I start Aphasia SG? I think starting Aphasia SG is really to address a gap in our community, because when we started it, there wasn't any support group or anything out there for people who have aphasia. Sorry, I'm just gonna stop share. So yeah, it is something very necessary, because obviously when you run out of therapy sessions in the hospital, what do? You still need a network, right? And sometimes it is not enough to just depend on people at home, because sometimes we hear this thing about family members coming to us and saying, oh, my dad, he after his stroke, right, he doesn't like to talk to family members anymore. He just keeps quiet. He will only talk with you in the session. We hear this so much, and we try to work with family members to train them, but sometimes it could be really just about widening that social circle. We want to really just prevent any not prevent, but minimize social isolation, and give all patients with aphasia an opportunity to meet others, and caregivers as well, to let them meet others who have the same problem. Okay, all right, so I think we're gonna switch track a little bit. Yeah, back to dysphagia, right? Holy moly guacamole actually asked, what do you think of thickeners? Can you briefly describe the taste and texture? Okay, well, that's a very specific question. So for the audience out there, if you're wondering what's thickener, right? In dysphagia management, sometimes we need to modify the food consistency or the fluid consistency, because the person actually has, for example, delayed swallow trigger, and they cannot swallow thin fluids safely. So to prevent aspiration, we will then thicken the fluids to a slightly thicker consistency, like a honey or nectar, which now goes by a different global standard. So we call it like IDDSI, IDDSI, IDDSI for short. So thickeners, okay, I think it's used a lot. It's used a lot as a compensatory way to let patients swallow safely. But I think whenever we can, we should do more therapy to actually help patients actually wean them off modified diets. That's ideal. But in certain settings that I work in, for example nursing homes, it is not very possible, because there's just nobody to assist the patient to do direct therapy. So they end up taking a lot of thickened fluids, which is not ideal, because it leads to dehydration. Can I briefly describe the taste and texture? There are different brands. Every brand has a different taste, different texture. It can be like xanthan gum, so it's gummy, right? Or it can be starchy, there's some brands that are starch based, which also then will thin down when it comes into contact with your saliva enzyme. And there's some amazing brands from the Japanese, from Japan, which to me, I think he's pretty good. So yeah, I would say if you are somebody who needs thickener, try different brands and see what you like best. It's not ideal, but it is necessary, I think, for some patients, because they may not have regular access to services. So we end up compensating using thickener. Yeah, right. Brilliant. Okay, thanks all who joined in. So we're coming to the very tail end of our AMA. Feel free to still ask questions. I'm gonna continue taking questions Oh, actually, yeah, it's really 9:31. I would like to really introduce all of you to my amazing social media team. But let me see where they are right now. Okay, cool. Okay, my social media team, you all hop on. I really want to introduce you to them because there will be no aphasia awareness campaign. Yeah. Okay, so I'm just gonna put them up. Woo! All right. Hello, hello.
Hello.
Okay, sounding good. Sounding good. Okay, let me see. Hello.
Wow, Marcus looks so handsome.
Okay, just have like the last few minutes. Last few minutes. So I really want to introduce you guys. Hey, where's our other member? Okay, let's
She's coming.
Yeah. Thank you all who just tuned in. We are coming to the tail end of our Ask Me Anything about speech therapy. Wow, I can't believe it's been like half an hour. But I want to use this opportunity to really thank my social media team. So I'm inviting them to share the space with me, to give them to really do a shout out, because without them there wouldn't actually be any Aphasia Awareness Month. And also ask them, to share a little bit about, just take 1 minute, right, to summarize your volunteer experience. Okay, but wait, Kim is having some trouble joining, I think. I'm not sure why, but she's unable to join. Kim, you need to use your handphone and not your iPad or computer. I think that's some of the problems. Okay, while we're waiting for Kim, never mind. Can I just invite, okay, so Marcus and Jeannie, oh, love your filter. Okay, I just want to say they have been amazing, throughout this entire formation of Aphasia SG. We have been so blessed and so supported by friends and, just kind people. And these volunteers have been invaluable to the whole setup. And I think sometimes people say, oh, I cannot volunteer because I'm not a speech therapist or I'm not a therapist. So I just want to say our team here, our social media team, they are not speech therapists, right? But they have been so amazing. So guys, maybe I'll just ask Marcus first. So Marcus obviously is the guy. Okay, Marcus, what has been the most rewarding part of volunteering for Aphasia SG?
I think it's all the little experiences. So I joined just a couple of months before COVID, right, in June 2019. And I wanted to learn more about speech therapy. At that point, I was thinking, hi Kim.
Yeah, sorry, Marcus can continue.
Yeah, so I was curious about speech therapy. Might I want this as my profession, my career in the future? So yeah, I popped by when it was all in person, and since then I've taken away a lot. Whether in trainings by Eve, which I've had a really privilege to learn from a lot. How to communicate with people in various ways, how to whether persons with aphasia or generally other people, how to interact and all these things. And I gain more empathy also, where I get to meet persons with aphasia and understand the different needs and the stories behind them. So I've gained a lot. Yeah.
Yay. Thanks. I think we I'm just so grateful to all our volunteers who joined. And Jeannie, can you share? So Jeannie is the one with the clouds behind. Yeah.
Oh.
Can you share with us? I mean, you joined us only during COVID, right? Only during the pandemic. So you didn't even have the experience of meeting our PWA face to face, unlike Marcus. So what motivates you to keep going and volunteering?
Yeah, so last time I used to do rehab at All Saints Home, and I met quite a lot of people who had stroke there, and they had aphasia also. So then I didn't get a chance to help them. So when I found out that my friend she has a group for people with aphasia, I was like, oh, that's so cool. Then I was like, okay, I'm very free. Let me just come over and help. Yeah, there's so many things to do, seriously, not just you don't have to be a speech therapist. Like there's just so many things that needs to be done. So
Yeah.
find what's your interest and then just join and lend a hand. And it's just really fun. And then when you see all the PWAs, they're so sweet. They're like so adorable.
Yeah. I think that's actually what, probably what keeps a lot of our volunteers going, right? I think just knowing, the PWA appreciate us so much, and we likewise, we appreciate them so much also. Yeah. Kim, yeah, tell us. What do you have to say for out there who are thinking about volunteering for Aphasia SG?
Okay. So I'll share a bit about my experience. I joined actually during maybe COVID period, and I had more experience with going online for the chit chat sessions. And then recently we went physical, right? We went for the physical chit chat sessions. I think mainly is like what Jeannie said. Sometimes when because we have sessions on Saturday mornings, right? And then sometimes when you wake up, you're like, oh, so tired. But then actually when you get to interact with the PWAs, the caregivers, I think it's very rewarding. It feels like a family. I'm sure like maybe Jeannie and Marcus will agree with me. Like when you see them, you can talk to them like friends, and then let's talk to them about life, how's your day and stuff like that. So I think that really keeps me going, when I volunteer here. Yeah.
Yay, yeah. Okay, before we round off, and because it's coming to the end of Aphasia Awareness Month, okay, each of us just share what is our one thing on our wish list for the aphasia community in Singapore. Okay, anyone can go first. I'll go last, yeah.
Okay, I'll go first. Okay, so I hope that people have basically they have more awareness about aphasia, because it's a very invisible condition. It's not something like, let's say, you can see like someone is probably blind where they use, let's say, a stick, but aphasia is very invisible. So I hope that maybe the community will be more kind towards them. Yeah, people with aphasia. Yeah.
Yeah. How about Marcus? What's on
My thoughts exactly there. Like,
Oh.
so, sorry?
Yeah, that's fine, yeah.
Yeah, really, we can do with a lot more kindness and awareness. I mean, we know here in our team and in our community that aphasia is so invisible. So even for us, we have a good amount of exposure to persons with aphasia, how they might talk, and it varies so much. But we cannot, I think even speech therapists, unless you really sit down and really get to know the person more or hear about the story, you cannot like at one glance tell, okay, that person has aphasia, that person doesn't have. So generally, if there's more kindness going around, being more patient with someone who accidentally bump into you, cut into your queue or something, even when it's like, how can it's just like, okay, some kindness and some empathy, some giving a bit more benefit of the doubt, can go a long way.
Yeah, thanks for that. I mean, I can tell you it's even for speech therapists, we will never know what it's like to be in the first person to actually have aphasia. We will never truly understand. It's so tough. That's why I think our members, they are the true heroes, right? Our caregivers are the true heroes. They what they do every time, every day. It's just amazing. Thank you. I think Evelyn Lim Louis says, keep up your amazing and sacrificial voluntary work. Much appreciated. Thank you for that. Yeah, thanks, Evelyn. Namesake. Yeah. Jeannie, what's on your wish list? Yeah.
I really hope aphasia can appear even more in the news. It's not just because there's so many different kinds, so people need to understand. So the more we get featured, the more people know. Then not just Bruce Willis case, but like there's just so many like ordinary people out there who have aphasia that we need to highlight their stories, their struggles, so that we know why is it important that we need to help them.
Yeah, I totally agree with all of you, and I cannot just emphasize enough how important it is that the community actually has a role to play in really building building a society that's more patient, that's kinder. You will never cut the queue of somebody in a wheelchair, right? But because you don't know when somebody has a communication problem, it's very easy for the person with a communication problem to face unkind acts. And these are things that we have heard many anecdotes. And it's very sad, because they are really struggling with communication, yet they still encounter acts of impatience, So I also hope that our society can be more patient towards those who communicate differently. Whether or not it is aphasia doesn't matter. Just I think give people benefit of the doubt. I like what Marcus said. And yeah, I think please follow us on social media. It helps us, it helps us when you give us eyeballs, and when you read our stories on our website. It will actually let you have a better understanding just by reading their personal stories, right? And if you search aphasia, CNA and all that, there's just really some amazing articles written this year, featuring Sherwin, one of our PWA and all that. So yeah, follow our YouTube channel. So go to YouTube, search Aphasia SG, and you find a lot of original content. Yeah. So I think with that, guys, yeah, I think it's time to say goodbye. I want to thank my amazing social media for putting this up, collating all the questions. Thank you all who joined in our Facebook. No, not Facebook. This is IG. Oh my god. I'm getting yeah. Thank you all our IG followers, for tuning in, for spending your 9 p.m. to 9:30 p.m. with us. We really appreciate you, and we appreciate you tuning in to listen about aphasia. Thank you so much. Okay, shall we do a happy? No, actually, Aphasia Awareness Month. Yeah, it's not really like happy Aphasia Awareness. But yeah, okay. So I think we will just say thank you and goodbye, everyone.
Thank you.
Thank
Bye
you.
bye.
Thank you. Bye.
Bye.
Bye bye.